Today, we're going to talk about cold and flu in adults. I'm Zeinab, I'm the pharmacist from PillSorted Pharmacy, and I'll cover what's the differences between cold and flu, what do they have in common, and how we can treat it best at home. Usually cold develops gradually within a day or two. It'll have a lot of runny nose, feeling stuffy and bunged up. With a flu, it starts quite suddenly. It'll start with body pain. You don't have that much of a runny nose, you might not get bunged up at all. What they do have in common though is giving you a sore throat, a bit of a cough, and a mild temperature. The good thing about both of them is they do clear up by themselves within a couple of days too. How can we feel better and what can we do at home? There's two important things lifestyle wise that'll help speed up the recovery. One is rest. Resting helps your body heal and it'll help make the recovery faster. The other one is plenty of liquids, especially warm liquids. So things like honey and lemon. Now, what are the medicines out there that you can buy? The important things are pain relief. You can have Paracetamol and ibuprofen quite regularly. The other one is saline rinses. So these are quite good for both adults and for children. There are spray forms as well that are better for children because they'll help them sneeze and clear up their airways. These you can use as often as you need. Then there is supplements. A high vitamin C can really be helpful. There are also decongestants. For the decongestant, there are herbal ones like the Obus sticks or the Vicks or the menthol base. These will help open up the airways. They're safe to use both in children and for adults. But there are some specific decongestants that adults can use, either in tablet form like this one. This is a pseudoephedrine. There are nasal sprays as well. The good thing about these, they're really helpful to open up the airways, but you can't use them more than 2 or 3 days because they can cause rebound congestion. So only 2 or 3 days. All of the decongestants are short-term use. For the things that both cold and flu can cause, like the sore throat, there's a couple of different things that you can have. So there are very safe ones, honey and lemon, or any other kind of these strepsils and lozenges. They just keep your throat moist, but they really are good to stop the coughing and the sore throat. So this is another kind of a lozenge. There are some medicated ones like this one as well. They work with making the inflammation less in your throat. They might come as spray as well, and they both can help reduce the inflammation. Now, these medicated ones you can't use too often, and most of the time you'll see a combination in the medication. So I've brought you a couple of examples of things that have got both pain relief, cough suppressant, and medication that can help you sleep, but make sure that you read what's inside them so you don't take another pain relief and these combinations together. This has got another kind of cough suppressant, a decongestant, and a pain relief in it. You might find them in sachet and powder form to mix into hot water and have it like a warm drink. There's also tablet and capsule forms if you find it easier than liquids. And what do you need to look out for in children? If the fever goes higher and higher, if their phlegm or their snot comes colored, if they're really unwell, that's the time that it might have changed into a secondary infection and they might need antibiotics. So reach out to the doctors. So as a recap, cold and flu are quite common, especially at this time of the year. Make sure that you get plenty of rest and liquids. And if you need any help, reach out to us. We're here to support you with that clinician-led safe advice. Thank you.